around the country, everyday Americans are joining the massive movement
Measure from the front of your ear
to help healthcare workers.
It stays nice and snug to keep any germs out.
Even companies like Nordstrom are doing their part, helping populations at higher risk of getting sick and helping people just hoping for a little more protection. And they're doing it one stitch at a time.
We appreciate it.
People like Sarah Maurer in Michigan have sewn 60 masks for hospital workers so far.
I feel great being able to help in the way that I can.
It's become a family affair in the Meyer household. In 6 days, Judy, Conrad, and their daughter Natasha have made almost 200 masks.
It's really amazing to see our community come together.
While there is no conclusive evidence that these homemade masks help prevent the spread of COVID-19, top health officials seem to think they may be more helpful than they once thought.
There is some rationale that the person in the street who may not know they're infected could actually prevent the spread to other people by wearing masks.
Even the president today says he's entertaining the idea.
I could see something like that happening for a period of time, but I would hope it would be a very limited period of time.
Their comments follow the recommendations of leading specialists from Asia, who are now saying that simple face masks and not hospital-grade masks may have played a role in helping them contain the coronavirus outbreak. The head of the Chinese Center for Disease Control and Prevention told Science magazine last Friday that the big mistake in the U.S. and Europe, in my opinion, is that people aren't wearing masks. Many people have asymptomatic or pre-symptomatic infections. If they are wearing face masks, it can prevent droplets that carry the virus from escaping and infecting others.
People should be wearing a mask from the data we've looked at whenever they go out in public.
Jeremy Howard, a research scientist at the University of San Francisco, wrote an editorial in the Washington Post highlighting data from COVID-19 success stories in Asian countries like South Korea, Hong Kong, and Taiwan, where everyone is wearing masks.
So I've analyzed 38 scientific papers that have looked at the relationship between using masks and the transmission of COVID-19 and similar kinds of viruses. And they all tell the same story, which is that wearing a mask can decrease transmission by up to 50%. So that could be enough to massively slow the spread.